Good Wednesday afternoon. I'm Dr. Martha Buchanan, a Public Health Officer and Senior Director here at Knox County Health Department. Our moment of gratitude today is dedicated to our team who orchestrated the change in our testing process this week so efficiently. This morning, in just an hour and a half, they were able to test 70 people. As a reminder, this week, piloting a new walk-up model with no appointments necessary instead of our previous call ahead and drive through model. This was done to more efficiently utilize our staff and remove any possible barriers to testing. We are grateful to our team who has continued to evolve their process to better suit our community. On that note, we are continuing walk-up testing at KCHD's main location today at 140 Dameron Avenue. Testing is also available to the public from 9 a.m. to 3 p.m. on Monday, Wednesdays, and Fridays every week. And then on Tuesdays and Thursdays, we continue to reserve that for targeted testing related to clusters and other special populations. As a reminder, no appointment is needed for testing at our facility. Folks can show up at any time that best suits their schedule. We are asking that everyone who comes for testing is wearing a cloth face covering to protect the people around you. We also ask that people coming for testing do not arrive in a large group to help us stick to physical distancing guidelines. In addition, our phone bank is still maintaining a list of walk-in and urgent care clinic providers who offer testing. This information is also available on our website. Moving on to our local situation. We have 441 confirmed cases of COVID-19 in Knox County. Additionally, we have 8 probable cases. 335 of our cases have recovered. 43 individuals have been hospitalized at some point in their illness. 1 Knox County resident is currently hospitalized. We are thankful that we have no additional deaths due to complications of COVID-19. We've received several questions regarding the increase in our new cases over the past several days and from last week. This increase in new cases is concerning, but as we have previously mentioned, we did expect to see an increase in cases as our community continues to reopen. There could be several reasons behind the increase in new cases, and we continue to investigate. There is more opportunity for testing. More people are out and about as our community continues to reopen, among others. In anticipation of more cases, we are continuing to expand our team to allow for more contact tracing, case investigations, and monitoring. We also ask that if individuals get calls from our team regarding a positive test result, please show some compassion as these individuals are asking the many questions they ask to help protect your loved ones and our community. We want to stress to our community that this virus is still very much present in Knox County and throughout the nation. And we continue to highlight the importance of the 5 core actions. Through our investigations of cases and clusters, we have often found the 5 core actions haven't consistently been followed. This is a trend we've seen across all demographics. These actions won't eradicate COVID-19 from our community overnight, but they are critical to reducing the rate of transmission. It's why we continue to repeat them as often as we do. Physical distancing, wearing a cloth face covering, washing your hands regularly and often, sanitizing surfaces regularly and often, staying home when you are sick or told to quarantine or remain in isolation. As a reminder, we will discuss the benchmarks and their corresponding traffic lights on Friday, as the benchmarks, including the traffic lights, are updated on the website weekly on Fridays. So now I'll open it up for questions.
All right, please type in your questions into the chat feature. And as a reminder, please type in your name and the media outlet in which you're associated with. First question from Megan with WBLT. How would you advise citizens to behave with cases at an all-time high? And additionally, when should someone seek testing?
So to your first question, the cases being at an all-time high doesn't change our guidance. We have been telling everyone to act as though they or someone else could potentially be asymptomatic and infected with COVID-19 from the beginning. and to observe the 5 core actions of physical distancing and face mask wearing and washing your hands and washing surfaces and staying home if you're sick. So nothing about our guidance changes. Your risk is the same throughout Knox County, no matter where you live, no matter where you work, no matter where you play. So all of those things have to be observed all of the time. And we know it's inconvenient and people are getting tired of doing it, but it's the only way we're going to really move our community forward and not have to revert back to phase 1. We don't want to do that. Nobody wants to do that. You're going to have to remind me the second question.
Was, when should someone seek testing?
If someone is concerned that they have COVID-19, so symptoms of COVID-19 actually have been expanded a little bit. Fever, cough, shortness of breath. There's also a loss of smell or taste. Some folks have some nausea and vomiting with COVID-19, fatigue, just don't feel good, and headache, I believe, are on the list. It's gotten longer as time has gone by. So those are the symptoms. We also know we have asymptomatic people. So if you've been exposed to somebody who has COVID, we definitely want you to consider getting tested. Not right away, because it takes time for the virus to incubate and to potentially make you sick. So we want you to wait a little bit. If you've been exposed, you should be getting a call from our staff to educate you about when testing is appropriate. But anybody who's concerned they might have COVID-19 should get tested. We have testing available throughout the community, and we have testing available obviously here, and we're no longer screening for symptoms. We're not screening for anything. So if anybody who's concerned they might have COVID or been exposed, certainly it's reasonable to get tested. I do want to remind everybody, a test is just a moment in time, and all it does is tell you if you have COVID right now or not. It doesn't tell you you'll never get it. It doesn't tell you anything about whether you had it in the past. It just tells you that you don't have it right now.
From Leslie with WBIR, 7 of the 8 cases reported today are people in the Hispanic community. Why are they being impacted so disproportionately?
That's a great question. And we are working diligently with partners in our community who work all the time with our Latino community to get information out. We have really, I think, learned through this process that there's some education and information gaps that we are striving hard to take care of. And so we're putting things out in a reasonable way and in formats that where it will be consumed by folks in the Latino community. There's also, people are gathering, we're letting people out, people gather a lot. And so we're seeing some of that as well, not limited to the Latino community. We're seeing clusters in other places as well. Although we are seeing a large impact and working hard to change that.
Leslie's follow-up question is, specifically, what has KCHD done to reach out to this community? And is there any plan to actually send people to these areas to make sure people have and know what they need?
It's a long list of things that we've done, so I'll probably leave some stuff off. I know that we did a focus group to get information to help us understand better what are the gaps, what are we missing, how are we not reaching out to these folks, and so that was very helpful. We've pulled in our bilingual staff, most of whom are from a Latino country, so they're able to give us some information on how to best do these things. We've also produced some videos that'll be, I think they went out already, that are going to be out there to be consumed on social media. And we're also looking into who are the people that work with these folks, the people that the Latino community trusts, so that we can get them to come and get tested. We really want people to get tested. And the important thing about getting tested is that we identify cases, we can isolate those cases, but protect those people around them as well. So that's very important.
From Brian Hornback, what is the response by KCHD when contacting someone through contact tracing and they are adamant that they will not comply with contacts and or be compliant with KCHD's request?
Well, we can't force anybody to tell us the information that we're asking about. Although we really do want them to tell us the information because it's so important in protecting their family and their friends and the broader community. So it's really about protecting people around you is why we're asking all those questions. We do have some tools in our toolbox. One's called a health directive, and that's a letter that just explains to the person that we've asked them to do these things, or the group of people, we've asked you to do these things. Here are the things we want you to do. And so for contacts who are simply in quarantine, that's as far as we can go. Our law office has given us that direct information. If someone is actually a case, we can actually take that a step further. We rarely have to do that, but we can actually do what's called a health measure. You can find this in the Tennessee Code, where we go before a judge and tell them the situation, tell them what's happening, tell them what we've done to try to educate, and ask the judge to court order the person to comply with isolation. And I forgot to say, we start with education. We always start with education. Most people respond to that because they don't want to make other people sick.
Any other questions? Please go ahead and submit them into the chat feature now. From Leslie with WBIR, what is the status for moving to phase 3 in the coming weeks?
Well, so we'll be giving more information about that next week. And we have a steering committee that's working to look at those things and provide guidance. So we'll be meeting later, and we'll be updating the benchmarks this Friday, but not updating guidance this Friday. As we said previously, it'll be next Friday when we update any guidance.
Our follow-up question is, are you concerned or talking about returning to phase 1 or staying in phase 2 longer since we've seen a rise?
So those are decisions that will be made in concert with city and county leadership. We'll be talking about that in the near future. We're also working really hard to see how can we, and some of it is how can you as a community help us expand our capacity to be able to do contact tracing, acknowledging that as we move forward, and hopefully we can move forward, we're going to have more cases and more contact tracing to do. We're already doing that. Businesses are being really cooperative and helping us, and we really appreciate that. So they're helping us with contact tracing. So we're continuing to expand our capacity in non-traditional ways, and my staff is being really creative to do that.
Any other questions? Please go ahead and submit them into the chat feature now. From Leslie with WBIR, at what point does KCHD consider a cluster a public health threat? And can you define what you consider a cluster more in detail?
So a cluster is defined by the state as two people who have a what we call an epilink or a common, right, that aren't in the same household. So they have to have a common event or a common place or some common connection that's not that they live in the same house. That's considered a cluster by the definition of the Tennessee Department of Health, and I believe also the CDC. So when we have that happen, what we do is we talk to both of those people like we always do, and we look at the situation where they may have been together in a place or in at an event, and we're reaching out to the people at those events or in those places at that time. And so when we believe that we have been able to, because people were cooperative and people were helpful, we've been able to contact all the people that might be at risk and either put them in quarantine, gotten them tested, or both, doing the things that we need to do. We've isolated the cases. We don't do a public announcement. We would do a public announcement if we were unable to find all the folks that were at risk and just needed to say, if you were at this place in this time frame, you might be at risk for COVID-19.
Any other questions? Please go ahead and submit them now. From Leslie with WBIR, any update from your perspective on the free masks that were being handed out?
I actually don't have any update at this time. We're still awaiting some guidance from the Tennessee Department of Health.
Any other questions? Please go ahead and submit them. All right, since there's no more questions being typed into the chat box, we'll go ahead and end the briefing. Thank you all for joining us, and we will talk with you Friday at 12:30. Have a good one.